Hi, my name is Dr. Alex Hakim. I'm a quadruple board certified physician in internal medicine, sleep medicine, pulmonary medicine, and critical care medicine. When I was training in the ICU at Cedars-Sinai Medical Center, I suffered from insomnia and didn't know why. I remembered my sleep medicine training from fellowship and began to pay close attention to my sleep habits, as well as any contributing factors to my insomnia. One of the things I learned from managing PTSD at VA clinics was how important mindfulness was in the quality and quantity of sleep. Let me explain. There was a patient I had who would fall asleep with a TV on, take a nap with the radio on, and during most times of the day, he kept his brain distracted from experiencing quiet rest. He told me something powerful that I would never forget. That one day during an electrical outage, he was alone at home with his thoughts, and he was haunted with intrusive images and emotions about the combat he had experienced while in the service. The man was using electronic devices to keep himself from having to address real issues his subconscious was grappling with. When doing inventory on myself, I noticed that I would listen to podcasts at home, car, and gym, as well as be saturated by electronic media. And I began to wonder, should I be surprised that once my bedroom lights are off and my head hits the pillow, my brain is filled with racing thoughts, leaving me unable to fall asleep? It seems that there is a certain level of dialogue that we all need to engage in with our unconscious minds. There are important planning and organizational needs that the mind engages in during quiet time. But most importantly, there is emotional processing that takes place as we consider the events of the day. I certainly wasn't involved in combat like veterans. I learned with PTSD. However, working in an ICU, I was regularly exposed to death and human suffering. Without realizing it, I had numbed myself with distractions and used the growing number of electronic devices and personally consumed media to prevent the necessary functions of our minds. In this case, we need some reflective moments to consider the powerful events of the day, process and plan for the future. It became clear to me that there were certain activities that helped me calm the mind in preparation for sleep. I began writing out thoughts and experiences, discussing them with people in similar fields of work, taking time away from distractions such as through meditation or leaving the headphones at home when going to the gym. While our conscious selves drive the car that is our mind, it is as if there is someone in the passenger seat who is anxious about the journey, a subconscious that is unsure of the chosen path. And it is a constructive, necessary daily ritual to address those internal concerns, doubts, not just to improve quality of sleep, but for the sake of mental health, focus, and clarity. Armed with this self-realization, I responded to a public post on social media, a site that was full of young subscribers with these concepts, and how to help with intrusive and racing thoughts at night. The audience of my posts were some of the most distracted individuals in society. These were high school and college students, young professionals who often surf the web aimlessly or play video games and binge watch their favorite shows when not at school. In addition, intoxicating substances like alcohol and marijuana are rampant among these kids. My post turned out to hit its exact target audience. Shortly after I submitted this endorsement of mindfulness as a solution to intrusive racing thoughts and difficulty initiating sleep, my post went viral. I had never experienced anything like that before. Though I was practicing exclusively as an ICU doctor at the time, I took note of how powerful and underappreciated the cognitive component of sleep is. As medical doctors, we sometimes have tunnel vision over the physical elements of sleep and the potential medication or devices that can remedy all our problems. A lot of it is convenience. It is inconvenient for a busy physician to have a meaningful dialogue about the psychological aspects of good sleep and proper mental function. I thought at the time, one day I need to revisit what a sleep practice should be like, and build one with a business model that can provide patients with the necessary time to solve their complex problems, the kinds of problems that may have tortured them over decades. Such things don't simply get solved during the brief encounters that typify modern medicine. With SleepDoc LA, you get access to medical resources, appropriate follow-up with a consistent doctor-patient relationship, and when necessary, the mental health aspects to sleep are addressed and prioritized. Finally, there is a way for me to provide a needed service, the only way it can be done properly. Beyond just mailing out devices and prescriptions, there is an opportunity to give the gold standard of care to a problem, the problem of poor sleep that is currently growing in an exponential way. Schedule an appointment for you or someone you love at sleepdocla.com today.